Okay, so good morning everyone. Today we have a very beautiful and elegant woman with us. We're not going to show her face because she wishes to respect her privacy. But it's a very interesting case because she has been suffering with quite severe androgenic alopecia for many years of her life. She has managed it very well. A couple of years ago we started her on oral finasteride, 5 milligrams. Which has been shown to be very effective for females to stabilize the androgenic alopecia and also prevent further escalation. And I think we have got pretty good stabilization. She has had one previous hair transplant via an F.U.T several years ago, and that one did afford her good density. So today what she really wants to do is top up the mid-zone of her scalp. And the main reason why is because when she wears her hair down and she wants to assume certain hairstyles, she finds it very difficult to do that because the light shines through and you can see her scalp. So we're going to be doing an F.U.E procedure today because unfortunately due to the F.U.T procedure where it's a cut from ear to ear, the scalp laxity is not great, and I'm fearful that if we did do an F.U.T, the linear scar normally heals very well, but I think we're going to have too much scar tissue when it does heal. So we've elected for a F.U.E technique. We're going to leave her hair long on the top. So I think it's very interesting the way we've actually mapped out her zone. We've done this over 3 or 4 sessions after very careful consultations with her because she wants to make sure that when she wears her hair down, this zone is not shown. So we're going to be doing a very small procedure today, roughly 1500 grafts, but the trick here is to really try and get the most bang for your buck, because we don't want to do too many grafts because her donor density is good, it's not fantastic, and we always want the back to look good as well. And secondly, we really want to get the best aesthetic results and not just maximal coverage, because she wears her hair a certain way, she has coverage in other areas, but it's really the mid-zone we're going to be doing it. So yeah, so you can follow along. We'll post her progress pictures in the next couple of months. We're going to keep a very close eye on her. But for now, that's all. Thanks.